A radiologic technologist, often referred to as a radiographer or X-ray technician, is a healthcare professional trained to perform diagnostic imaging examinations, such as X-rays, CT scans, and MRIs. Working closely with radiologists and other physicians, radiologic technologists use advanced imaging equipment to help diagnose and monitor various medical conditions. Their work is essential in nearly every aspect of medical care, from emergency rooms and surgery centers to outpatient clinics and mobile imaging units. This video provides a comprehensive look into the job description of a radiologic technologist, including their daily duties, core responsibilities, essential skills, and educational requirements. Whether aiding in the detection of fractures, tumors, or internal anomalies, these professionals are indispensable to accurate diagnosis and effective treatment planning. Overview of the role. Radiologic technologists are responsible for producing high-quality medical images while ensuring patient safety and comfort. Their job involves preparing patients for imaging procedures, operating imaging machinery, positioning the body accurately, and working collaboratively with radiologists to deliver accurate diagnostic results. In addition to technical expertise, radiologic technologists must prioritize patient care and confidentiality. They are often among the first healthcare providers patients encounter when undergoing diagnostic testing, making interpersonal communication and empathy key aspects of the role. The job description of a radiologic technologist can vary slightly depending on the workplace, be it a hospital, imaging center, or private clinic, but the foundational responsibilities and skills remain consistent across all settings. Roles and responsibilities of a radiologic technologist. The work of a radiologic technologist combines technical proficiency with direct patient care. Their responsibilities stretch from operating complex imaging equipment to assisting patients with physical limitations and maintaining meticulous records. 1. Performing diagnostic imaging procedures. At the core of the radiologic technologist's responsibilities is conducting imaging procedures. These include standard X-rays, fluoroscopy, computed tomography, CORT, magnetic resonance imaging, MRI, and sometimes mammography or bone densitometry, depending on certification and training. The technologist must ensure the imaging equipment is calibrated and functioning properly, position the patient accurately, and use appropriate exposure techniques to produce clear and detailed images that can aid in diagnosis. 2. Preparing patients for procedures. Before conducting any imaging scan, the radiologic technologist explains the procedure to the patient, answers questions, and ensures the patient is comfortable and informed. For some tests, this includes giving instructions about fasting, removing jewelry, or changing into a gown. During the scan, the technologist may have to assist patients with limited mobility, calming those who are anxious, and making special accommodations for pediatric or elderly patients. 3. Ensuring patient safety and radiation protection. One of the most important responsibilities of a radiologic technologist is minimizing radiation exposure. This includes using protective equipment like lead aprons and shields, positioning patients correctly, and adjusting exposure settings based on the patient's age and body type. The technologist must also follow strict safety protocols to protect themselves, coworkers, and others in the imaging environment. Understanding and applying radiation safety principles is an essential part of their role. 4. Collaborating with physicians and radiologists. Radiologic technologists work closely with radiologists who interpret the images, as well as with referring physicians who use imaging results to make clinical decisions. Technologists must ensure that images meet diagnostic quality standards and may be required to repeat procedures or adjust techniques based on physician feedback. Though they do not diagnose conditions, technologists must recognize normal and abnormal anatomy, ensuring that images capture the required views and relevant body parts. 5. Maintaining imaging equipment. Radiologic technologists are responsible for the routine inspection, maintenance, and troubleshooting of imaging equipment. They report any malfunctions or calibration issues promptly and may assist in quality assurance programs to ensure consistent performance and accuracy. Advanced knowledge of how each machine works and how to operate it safely is critical to the role. 6. Managing patient records and documentation. Accurate documentation is vital in medical imaging. Radiologic technologists are required to record patient histories, procedure details, exposure levels, and other relevant information in both digital and written formats. This information becomes part of the patient's medical file and assists physicians in treatment planning. Strong attention to detail and familiarity with medical record systems are necessary for effective record-keeping. 7. Assisting during interventional procedures. In some healthcare settings, radiologic technologists support interventional radiology procedures. These may include biopsies, angiograms, or catheter insertions that require real-time imaging guidance. The technologist may assist with equipment setup, sterilization, patient positioning, and capturing continuous imaging sequences during the procedure. Precision, focus, and coordination with the interventional team are critical in these scenarios. 8. Adapting to different clinical settings. Radiologic technologists may work in emergency departments, operating rooms, intensive care units, or outpatient clinics. Each setting demands different workflows and patient care strategies. For instance, portable X-ray machines are used in ICU or emergency settings when patients cannot be moved. In surgical settings, intraoperative imaging requires sterile techniques and real-time adaptability. 9. Providing emotional support to patients. Many patients undergoing imaging procedures are anxious or in pain. Radiologic technologists must offer reassurance, compassion, and professionalism during their interactions. This is especially true when dealing with children, trauma victims, or those facing a serious diagnosis. Strong interpersonal skills help technologists put patients at ease, leading to better cooperation and more accurate imaging outcomes. 10. Continuing education and professional development. Due to constant advancements in imaging technology, radiologic technologists are expected to participate in ongoing education and training. This ensures they remain current with the latest best practices, safety protocols, and equipment usage. Continuing education is also necessary to maintain licensure and certifications. Skills required for a radiologic technologist. The job of a radiologic technologist requires a blend of technical, clinical, and soft skills. Among the most essential are: 1. Technical expertise. Mastery in operating a range of imaging machines and software. 2. Anatomical knowledge. Understanding of human anatomy and physiology to capture accurate images. 3. Radiation safety awareness. Ability to apply safety protocols to protect patients and staff. 4. Communication skills. Clear and compassionate communication with patients and effective collaboration with medical teams. 5. Critical thinking. Quick decision-making in emergency or complex situations. 6. Attention to detail. Precision in image capture, equipment operation, and record-keeping. 7. Adaptability. Ability to work across various medical environments and patient conditions. Education and certification requirements. To become a radiologic technologist, one must complete formal education and obtain licensure or certification based on the region's regulatory requirements. 1. Education. Typically, an associate's degree in radiologic technology is the minimum requirement. 1. Some pursue a bachelor's degree for broader opportunities. 2. Certification. Most employers require certification by a recognized body such as the American Registry of Radiologic Technologists, ARRT. 3. Licensure. In many states and countries, technologists must be licensed, which often involves passing a standardized exam. 4. Specializations. Radiologic technologists can pursue additional certifications in areas such as mammography, CT, MRI, or interventional radiography. Completing clinical rotations during the educational program provides hands-on experience and prepares students for real-world challenges in diagnostic imaging. Work environment and career outlook. Radiologic technologists typically work in hospitals, diagnostic labs, outpatient clinics, urgent care centers, and specialty practices. Their work often includes evenings, weekends, and holidays, especially in 24-hour facilities. The job may involve standing for long periods, moving or lifting patients, and working in dimly lit rooms. Safety procedures must always be followed to minimize exposure to radiation. The demand for radiologic technologists is strong and growing, driven by an aging population, technological innovations, and increased reliance on diagnostic imaging. According to labor statistics in various countries, the job outlook for radiologic technologists remains positive, with steady growth expected over the next decade. Technologists with advanced certifications or who specialize in modalities like CT, MRI, or mammography often enjoy greater job prospects and salary potential. Conclusion. The job description of a radiologic technologist is centered on producing high-quality diagnostic images that help physicians diagnose and treat a wide range of medical conditions. This role requires a balanced combination of technical expertise, patient care, and dedication to safety and accuracy. Radiologic technologists play a pivotal role in modern medicine. They serve as the eyes of the healthcare team, capturing the internal views that guide diagnosis, treatment planning, and surgical intervention. Their commitment to excellence ensures that patients receive the best possible care while minimizing risk and discomfort. Whether working in a bustling emergency room or a quiet outpatient clinic, radiologic technologists help bridge the gap between technology and patient care. With strong demand, rewarding challenges, and continuous learning, this career offers both professional fulfillment and the opportunity to make a meaningful difference in people's lives.